And welcome back. We're on with Mr. Robert Love, I believe, with an organization called Delta Dads. Do we have that much correct so far, Mr. Love?
Yes, sir.
All right. Okay. Glad to have you on this morning. Tell us a little bit about your organization that's called Delta Dads.
Okay. Uh, Delta Dads is a fatherhood program under the umbrella of Delta Health Alliance,
Okay.
and we're with the Healthy Start Division. The Healthy Start is all about working to slow the trend of maternal and infant deaths in Black and minority communities. And the Delta Dads program has found out that when the dad is involved in the family, then the children tend to live longer and the moms tend to survive the birthing process.
Wow. When you say slow the death, that kind of felt that. So we're talking about for the very young. What age
Yes,
is this death occurring?
yes, it's actually occurring from birth to 18 months,
Okay.
and excuse me,
We're good.
and the moms tend to pass away more often in the Black community and the minority communities in the birthing process, and the children tend to pass away within 18 months. We're 40% more likely in the Black community for our children to die within 18 months. And so research shows that if a dad is involved in the picture to support the mom and the infant, then mortality rate drops. Research also shows that children live longer and healthier lives when there's an involved dad in their lives. Research has found that fathers who are absent increases the infant mortality rate. And so we're just trying to make sure that our dads have a support system, that the moms have a whole lot of support systems, a whole lot of programs. We want to make sure that dads have a support system, make sure they know that they're very important to the lives of the children, important into the lives of the moms, and that if they're just there and they're just available, we'll support them in being available to the children.
This seems to be helpful emotionally as well as anything else. What are some of the things that dad can do to ensure a healthy life uh, during this period of time, from birth to 18 months? What can a dad do for mom, for the mother, and for the child?
Well, for the moms, we try to promote breastfeeding,
Okay.
and so the dads can support in breastfeeding by simply doing whatever else that needs to be taken care of while the mom is breastfeeding, because our moms tend to get overwhelmed with life and overwhelmed with things that are going on around them. And so if the dads are just present to take care of what needs to be taken care of, go and get the support pillow, making sure that everything is well in the household while that is going on. Or if the dads can just change diapers or help to changing diapers, help fixing meals and things like that. We've been training our dads how to fix simple breakfasts for the family to help mom, and so all of those things and more can help support the mom and the baby.
When you're talking to fathers about this, is this something that a little awkward with them? Do they receive this information well? Because actually is actually helpful, no question about that. But how the fathers receiving that to come in again to help ensure that the mother's doing fine and the baby's doing fine. Again, the initial question: how the fathers receiving that new role? So
Yes. Well, the way I approach fathers, the first thing I let them know is there's a lot of programs for everybody else, and it seems like the fathers are the forgotten people. And I try to let them know that the fathers are just as important as the mothers in the family. Their role is important. We cannot subtract the fathers and have a healthy family. And so I let them know that if they are present, if they are available, if they might not be married to the mom, but if they're just present in the life of the baby, then their presence makes sure that the baby doesn't get abused. Their presence makes sure that the family has a support system when it comes to different people, different programs, and different sources that come to the family. I also let them know that you can be a good parental partner, even if you're not married to the mom. You can be a good parental partner. You can get along with the mom. You can see your child. It's not just about child support. It's about being there. It's about supporting the child as they grow up And a lot of our dads are responding because that's what dads really want to do. They want to feel like they're a part. They want to be welcomed into the family by society and by the community. And I've had a real positive response from the fathers because we also offer a support program for them. We have something called 24/7 Dads in the Delta Dads program. We get together fathers just like themselves that have young children, and we talk about issues. You know, we talk about stress that fathers have to deal with. We talk about health issues. We talk about, you know, a lot of our dads, a lot of our men don't like to go to the doctor. I make sure that they keep their appointments, and I make sure they keep their numbers together, their health numbers together, just to let them know you guys are important also. You are needed. You are effective in what you're doing. We just need you to be available.
You know, I like this this whole idea and the whole concept. Many times, men are absent from that child's life, not by choice. Have you had a situation where, let's say, once the baby was born, before the baby was born, there was a split up between the mom and the dad? Have you been able to work them back together so their father can be a part of that child's life, and then the mother in a support way, as you said? Have you had any cases like that?
Yes, part of our program is called Moms at the Gateway. And we talk to the mom. We try to bring the moms and the dads together on the platform. And we talk to them, letting them know that moms are gatekeepers. A lot of times the family, they let in who they're going to let in. They don't let in who they don't want to let in. And we try to stress to them that the dads are important enough to let in, and that there's a lot of things that little boys are looking for mentors, little girls are looking for someone to protect them and to show them that this is the ideal spouse or the ideal mate for them later on in life, and that there are certain things that moms just cannot teach, that dads will teach by their example. And we try to let them know that, you know, if you just open that gate and let the dads in, open that gate, even if you guys aren't together, open that gate and let that dad be a part of that child's life, then that child is going to be healthier emotionally. That the behavior of the sons is going to be better when the dads are in the picture. The behavior of the daughters are going to be better when the dads are in the picture. And we have seen some success in doing that. And when we've also even seen a couple kind of brought back together. I don't know if they're going to stay together, but
Okay.
we've seen a couple kind of brought back together for the sake of the child.
Mm-hmm.
And I recently even had a couple right after the child was born. I had a dad that decided to ask the mom to marry her. And I was like, wow, this is awesome. And so seeing his child open up the mindset for marriage in his life to the mother of his child. And so we've been pretty effective in that area.
Yeah, Delta Dads. How old is this organization?
So the program, the Delta Dads program, is about a year old. We just started, and I just started last year in September.
You know, I'm listening. Is there another program going on anywhere else across the Delta, across the state, or is this the first of its kind? Definitely needed. Or was it the same kind of program, but under another name? I don't know. Just asking.
I'm sure there are various fatherhood initiative programs throughout the Delta. In fact, I have met one gentleman in Indianola, and there's another gentleman in Lexington that runs similar programs. And of course, they have different names and everything. But this is the first of its kind for Delta Health Alliance.
How do you feel being a part of this program, and its work that you're doing?
I'm sorry, I didn't hear you.
How do you feel being a part of this program and the work that it's doing and that you're doing? To talk about you.
I love it. I've actually been a pastor for the last 14 years. And I didn't know this type of program existed. And so when I became a part of the program, I was like, this is what I've been doing through the church, and I didn't know I can do it, through another avenue.
Okay.
And so I've been able to do the same thing through the program that I've been doing in ministry for years, which is gather young men together and try to be a mentor and help them and guide them and counsel them. And all of that, and so through the program, I have the resources. I have more things that I can do for them. I help them with job searches. I'm able to help them get, baby wipes and bottles for their children, and baby seats and things like that. And so I love it. I love being a part of it. The men that are in the program, they love it. They love being a part of it. They're helping me to recruit other men. But as you know, a lot of times men don't want to be in a quote unquote program.
Mm-hmm.
But it's a great thing to be a part of, and I'm just delighted to be doing what I'm doing right now.
We are talking with Mr. Robert Love, who is associated with Delta Dads, which comes under the umbrella of Delta Health Alliance. Is that right?
Yes.
Okay. How do dads contact you, or moms contact you to contact dads? How do you all get connected?
Okay. Well, I operate the Delta Dads program in LaFleur County, Humphreys County, Yazoo County, and Holmes County. And I can be contacted through Delta Health Alliance, www.deltahealthalliance.org, or they can get my cell phone number, 769-798-1011.
How many people currently are participating in the program that you all have?
24.
Okay.
We
How many can you
have,
accommodate?
I'm sorry, say it
How
again.
many can you accommodate? How many is there a cutoff number?
There is no cutoff limit.
Okay.
There's no cutoff limit.
Good. All right. Anything you'd like to leave with us? We appreciate your time and like to talk with you more. The work sounds very, very, very necessary, and we appreciate that you're doing it. You seem to have the right attitude, and boy, anytime you can save lives and connect families and keep folks healthy, nothing greater than that. And also, even helping folks find a job. So that's great. Anything you want to leave with the audience this morning?
Just to let them know that we're always looking for more participants. We're always looking to just be a part of your events. If you have events going on and you want a speaker, you want someone to reach out to Delta Dads or Dads in the Delta, then I'm always available to speak. Just give us a call and let us know. We can be of help of any kind.
All right. Thank you, Mr. Love. We really appreciate it. Keep up the great work.
Thank you.
All right.